Transfer. I'm joined by Correctional Services Spokesperson Singabakho Nxumalo to share more details. Singabakho, good evening and thank you very much for joining us on the Newsfeed Late Night. I can confirm then with you that Angelo Agrizzi has been transferred and moved to a private hospital. What about the security and the manding of Angelo Agrizzi while he's in that private facility?
A very good evening to you and the viewers, and thank you for the opportunity. Yes, indeed, we can confirm that remand detainee Agrizzi was transferred in the afternoon to a private hospital. This follows a request which was made by the family. And as a department, we had to consider it following our policy and procedures, and indeed it was granted, hence then the transfer. But this comes with certain conditions. The state only pays when an inmate or remand detainee is transferred to a public hospital. But when a family or inmate says, no, please move me to a private hospital, they then have to then pay their own costs and also to take into consideration the risk involved that the state, cannot be litigated should something go wrong there. But we must provide security. And the applicant will have to pay the department for the security that must be provided. Remember, it has to be 24 hours a day. So this was explained to his family. They then committed to say they will pay for medical costs and all other related costs, and also pay the Department of Correctional Services for the guarding duties at the private hospital.
Well, are correctional facilities so poor that they couldn't take care of a chronically ill Angelo Agrizzi that he had to be transferred to a private hospital?
It is not a matter of being poor, but it's all about what type of a service can you get in a correctional facility. We specialize in primary health care. So hence then we have professional nurses and also have sessional doctors in our facilities. But when a condition requires that a much more sophisticated equipment has to be used, and you also need additional brains around that. We then have a relationship with public hospitals where we are then able to transfer an inmate, perhaps at a tertiary hospital where one can then receive, that additional care or additional needs. And then if a person decides that, no, I don't want to stay here, let me be transferred to a private hospital, that gets considered as well, also looking at the risk. But what we have in our facilities is sufficient and is enough, to at least protect the life of an individual. But if it requires that, sophisticated machinery is needed and also other services which we may not have, then we have to transfer that person to a public hospital. To us, what matters the most is that each and every individual receives appropriate care.
Now, what happens, Singabakho, when, for example, you are seeing a growing population of older prisoners who are probably doing life, and they have now a prevalence of chronic medical conditions? Is our justice system, our correctional services system, improving as far as prison health care is concerned for the chronically ill? And what interventions are being put in place?
You will be amazed that quite a significant number of inmates are on chronic medication. And hence then we have professional nurses assisting us. We call it a care program, because we even have pharmacists inside our centers who assist inmates, along the way to say, if you've got this chronic illness, how to go about taking your medication, how to manage it, and when you have to come for, the next stock and all those things. They even monitor whether someone is not abusing that medication. In the past, we have people at times selling some of that medication. Hence, then we had to really tighten that up. So we have a system which is working. But as I've said, it's only on exceptional cases where a person has to be transferred outside. It's merely because perhaps particular equipment is needed and that is not available in a correctional facility. Hence, then a public hospital, will be used. But we have not experienced a situation where now you have quite big volumes of people who now must be transferred using a much bigger mode of transport merely because a correctional facility is unable to give care to that person. Yeah. What we have currently in the system is working for us, but when someone needs additional care, we have to respond to that.
So Mr. Agrizzi was in court. He was seen with a little box of oxygen, which he needed, but there are other comorbidities that he was dealing with. But the situation in the prison was such that he couldn't go ahead with his self-management strategy. And that's what I'm trying to understand. What is it that was failing that did not allow him to go ahead with that self-management strategy? Because the lawyers are arguing, well, let him be under house arrest, because at least when he's at home, he'll be able to do that self-management strategy.
You've got to take into cognizance a number of factors when a person is admitted in a correctional facility, particularly for the very first time. It comes with a number of challenges. Psychologically, mentally, it challenges an individual. Some people do adjust quite easily, some find it hard. Hence, then, when a person is admitted, we do a proper assessment, which involves the healthcare workers, having to assist that particular inmate. They even then check that person the following day. And should they pick up that certain things require serious attention, they will then call other medical experts to assist them. And then they come to a decision that, no, perhaps this person must be transferred to an outside facility. Again, this is done, in order to make sure that a life of an individual is protected. Then after that, then a person, will be transferred back to a facility. If it means a person must go to one of our medical facilities inside DCS, we are then able to do that as well. But it's all about preserving the life, because that all matters the most. Individuals or people must be treated the same, must be given appropriate care, and we've got to make it a point that we go an extra mile in protecting that particular life. Whether a person is guilty or not guilty, is a criminal or not a criminal, life remains important, and that is enshrined in the Constitution of this country.
Now, the medical condition of Mr. Agrizzi was unable to persuade Magistrate Fender to grant him bail, but having spent the time in prison and having seen how he's reacted to the conditions, would you say he is a candidate for correctional supervision or house arrest?
Such a decision can only be made by the relevant authorities. At this stage, what remains critical is that he receive appropriate care. And then should authorities decide that, no, perhaps certain things must be taken back to court, or they must be taken to other structures within correctional services, they will do that. But for now, what remains of priority to us is that appropriate care is given to an individual, and that's where we are.
Singabakho, we appreciate your time. Thanks for joining us tonight. That is Singabakho Nxumalo speaking on behalf of the Department of Correctional Services tonight. Meanwhile,